So, in your practice, what are the most common spine problems you see in kids?
Good evening. குழந்தைகள் வந்து நம்மளோட பொக்கிஷம் இல்லையா? So let me just classify pediatric spine problems into two. So organic causes and lifestyle causes. So organic causes la dhaan we come into the picture. Lifestyle causes something that parents need to be very conscious about. ஸோ இந்த ஆர்கானிக் காசஸில் பார்த்தீங்கன்னா கன்ஜெனிட்டல் டிஃபெக்ட்ஸ், பிறவிலேயே இருக்கிற சில டிஃபெக்ட்ஸ், அது ஸ்பைனல் கார்டில் இருக்கலாம், அது த பேக் போனில் இருக்கலாம், தென் அப்நார்மல் கர்வச்சர்ஸ் ஆஃப் த ஸ்பைன் வந்து வளைஞ்சிருக்கலாம், தென் சர்டன் நியூரோமஸ்குலர் டிஸார்டர்ஸ் இருக்குது. ஸோ எவ்வளவோ இந்த ஆர்கானிக் காசஸ் இருக்குது. இது எப்படி நம்ம கண்டுபிடிக்கிறது? வாட் ஆர் த சிம்டம்ஸ்? சில குழந்தைகளில் we see motor developmental delay, pain of course is there, but என்ன மாதிரி பெயின்? Is all pain because of pediatric spine problem? The pain that causes disruption of sleep impacts activities. அதோட சேர்த்து ஒரு tingling, numbness, மதமதப்பு, pins and needle sensation, bowel and bladder control இல்லாமல், சொல்ல முடியாமல், இல்லை அடக்க முடியாமல், dribbling. So all these abnormal symptoms are also associated with pain. So இதுதான் organic issues. Lifestyle issues. See, off late we are seeing a lot of back pain and neck pain in children. Why? Bad posture, phone dependency, screen dependency. கையில் அப்படியே ஃபோனை வச்சுட்டே இருக்கிறது, சாப்பாடும்போது screen time.
Ma'am, that's a good point. So, at what age should you allow a kid to use a phone?
According to the American Academy of Pediatrics, 18 மாதம் வரைக்கும் absolutely no screen time. After 18 months, only 30 minutes are allowed. நம்ம வீட்டில் invariably all meal times are with screen. So bad posture, screen dependency, physical inactivity, sedentary lifestyle, limited flexibility. எந்த ஏஜில் இந்த muscle tone, balance, coordination develop ஆகுதோ அப்போ we don't give the right kind of activities for our children. So it has a very bad effect.
Thank you ma'am, thank you very much. Over to you. So the kids come from the mom. So Dr. Madhu ma'am, does pregnancy contribute to back pain, number one? And what should expectant mothers do in order to prevent this?
வணக்கம் சென்னை. ஸோ லேடிஸ் பொறுத்த வரைக்கும் ப்ரெக்னென்சிக்கு முன்னாடி, ப்ரெக்னென்சி டைமில், போஸ்ட் ப்ரெக்னென்சின்னு மூணாக பிரிச்சுக்கலாம். ப்ரெக்னென்சிக்கு முன்னாடி எக்ஸ்பெக்டிங் பீப்புள் ஹூ வாண்ட் கன்சீவ் முதல்ல வெயிட் ரெடியூஸ் பண்ணுறது ரொம்ப ரொம்ப இம்பார்ட்டன்ட்னு இங்கே பதிவு பண்ண விரும்புகிறேன். ஏன் அப்படின்னு சொன்னால் பிஎம்ஐ, பாடி மாஸ் இண்டெக்ஸ்னு இருக்குது. ஒவ்வொருத்தங்களுக்கு எவ்வளோ ஹைட்டுக்கு எவ்வளோ வெயிட் இருக்கணும் அப்படின்னு. அந்த பர்டிகுலர் ஹைட் வெயிட் ரேஷியோ கரெக்டாக இருந்ததுன்னா மோஸ்ட் ஆஃப் தி பேக் பெயின் விச் ஹேப்பன்ஸ் டியூரிங் ப்ரெக்னென்சி நடக்கிறது இல்லை. ஸோ மோஸ்ட் ப்ராபப்ளி ஒன்ஸ் தே என்டர் வித் ப்ராப்பர் பிஎம்ஐ, பேக் பெயின் ஸ்டார்ட் இன் த செகண்ட் தேர்ட் ட்ரைமெஸ்டர். அதாவது லாஸ்ட் 6 monthsல தான் அந்த பேக் போஸ்டர் மாறும் ஃபிசியலாஜிக்கலாகவே பிகாஸ் ஆஃப் த ஹார்மோன் சேஞ்சஸ். ஒரு லேடியை பார்க்கும்போதே வயிறு முன்னாடி வர வர பின்னாடி அவங்களுக்கு கர்வேச்சர் அதிகமாகும். அப்போ ஆல் த லிகமெண்ட்ஸ், மசில்ஸ், அந்த ஸ்பைன் கூட இருக்கக்கூடிய மசில்ஸை பாராஸ்பைனல் மசில்ஸ்னு சொல்லுவோம், இது எல்லாமே வீக் ஆகும். அண்ட் ஸோ இட் இஸ் வெரி வெரி இம்பார்ட்டன்ட் தட் தே டூ எக்ஸசைசஸ் இன் கேஸ் ஹை ரிஸ்க் ஆப்ஸ்டெட்ரிக்ஸ் அந்த மாதிரி இருக்கிறவங்க, லைக் யூனோ உங்கள் டாக்டர்ஸ் சொல்லியிருக்காங்க எக்ஸசைசஸ் ரொம்ப பண்ணக்கூடாதுன்னா, வாட் எவர் மினிமல் எக்ஸசைசஸ் தட் யூ கேன் டூ, அட்லீஸ்ட் வாக்கிங், அது பண்ணுறது மூலமாக பெயினை முக்கால்வாசி குறைக்க முடியும். இதையும் தாண்டி போஸ்டர் அதை கரெக்ட் பண்ண வேண்டி இருக்கும். ஆல்ரெடி தெர் இஸ் அ கர்வேச்சர். ஸோ டியூரிங் ப்ரெக்னென்சி சாய்வாக உட்கார்றது ரொம்ப ரொம்ப இம்பார்ட்டன்ட். இடுப்பு பகுதி, தோள் பகுதி, தோள் பட்டைன்னு சொல்கிற இடம், அண்ட் பேக் ஆஃப் தி ஹெட், இது எல்லாமே ரெஸ்டாக இருக்கணும். நாட் இன் சச் அ கைண்ட் ஆஃப் அ சேர் வேர் யூஆர் நாட் சப்போர்ட்டட் போத் இன் த நெக், இன் த ஷோல்டர் அண்ட் இன் த ஹெட். அந்த மாதிரி ஒரு சப்போர்ட்டிவ் சேரில் உட்கார்றது வில் ஹெல்ப். போஸ்ட் டெலிவரி அந்த டைமில் எக்ஸசைசஸ் ஆர் வெரி வெரி இம்பார்ட்டன்ட். அண்ட் கால்சியம் இன்டேக் எல்லா டைம்லையுமே when they are actually entering into pregnancyலேருந்து முடிஞ்சு breast feeding பண்ணி வெளில வர வரைக்கும் it is very very important that they consume calcium.
Ma'am, how early can you start exercises after delivery?
People who are actually exercising, they do not have to have a stop. ரொம்ப high impact aerobic exercises, people who have Zumba training, இந்த மாதிரி இருக்கிறத மட்டும் அவாய்ட் பண்ணால் போகிறோம், particularly around the time of delivery. அதுக்கு முன்னாடி இருக்கிற டைம், some of the marathon runners usually do their running even during pregnancy. So as long as you're not into high risk or your obstetrician has not told you to stop doing whatever you've been doing, you can continue to do the same.
Thank you.
There will be very very minimal risk if you are at a high risk pregnancy.
Thank you, ma'am. Thank you very much. And over to you, Anjana, the most pretty lady here.
Thank you.
So we got to know that you had a spine surgery, and I was surprised to watch you walk with pencil heels. So could you share with us what your fears and what you went through and how you are coping through that after surgery?
Yes, this is all experience at the end of the day. But thank you, doctor. Thank you for everything. Hello, everybody. என் பேர் அஞ்சனா. எனக்கு வந்து I had congenital scoliosis, which is basically having scoliosis from birth. And we didn't treat it for a very long time. For the main reason is because fear. We had a lot of fear. What would happen if I, go through a surgery? Would I even be alive? Would my legs even work after the surgery? So there was a lot of fear, but we took the courage. I spoke to my parents saying that I have to get this done. I have a lot of dreams, mostly facing the camera. So adukku konjam prim and proper nalla irukanum paaka. Adukkaga I wanted to get this whole surgery done. It was a very big, major surgery that I went through. And like I said, it was a lot of fear before the surgery. And at the end of the day, I got it done. It was great because of the people who worked on me, Dr. Balamurli, Dr. Ranjit, and Dr. Vignesh back then. One thing to say, after surgery, I felt even more confident. I'm able to do a lot of things right now, be it modeling, acting. And one more thing is I do a lot of strength training right now, which has helped me a lot. And one more thing is I try to maintain my weight. That is helping me a lot because now weight potena and back pain varum, I'll feel uncomfortable and I won't feel myself. So I try to maintain my weight.
Thank you very much, Anjana. Over to Usha, ma'am. I got to know that you combined multiple roles at the same time. You also had back pain, you underwent surgery. Could you share with us your challenges which you had when you went to surgery, pre and post-operative, and today how do you live with it?
வணக்கம் சென்னை. முதலாக நான் ஒன்று சொல்லணும் என்னென்னா, going to work and managing a family itself is extremely daunting. அதில் வேறு உங்களுக்கு பேக் பெயின் இருந்ததுன்னா all the more the pressure is. See, back pain is a very, very severe problem. You may not physically, as Dr. Balamurli mentioned, if you say you have a back pain, you can't show it out. Like, in the sense it doesn't swell somewhere, it doesn't hurt somewhere, you can show people. அந்த மாதிரி pain for decades, 30, 35 years I've been suffering. And always அது வந்து back burnerல இருக்கும். இதான் நமக்கு life, it became a part of my life. Having back pain புதுசு இல்லை. தினம் எந்த ஒரு வழி இருக்கும் போகணும். ஒரு ஸ்டேஜில் வந்து it was so bad that I could not get out of my bed. ராத்திரி ரெஸ்ட் ரூம் யூஸ் பண்ணுறது கூட I used to get so scared. By 5 o'clock, 6 o'clock நான் வந்து தண்ணி குடிக்கிறது கூட நிறுத்திடுவேன். ஏன்னா நைட்டில் எழுந்து ரெஸ்ட் ரூம் போகணுமே, எப்படி எழுந்துக்கிறது. எக்ஸ்ட்ரீம் பெயின் டவுன் மை லெக்ஸ் I used to have. Then I decided இது வந்து இப்படியே போயிட்டு இருந்ததுன்னா it's not going to help anybody. Fortunately, I went and met a good team at Kauvery, Dr. Kirti and Dr. Balamurli. This is not a paid promotion for Kauvery Hospital or Dr. Balamurli or Dr. Kirti, but they are the most emphatic doctors I've ever come across in my life who made me understand or prototype. நம்ம ஜென்ரலாக ஒரு ஸ்பைன் சர்ஜன் கிட்ட போனால் என்ன பயப்படுவோம்னா, எங்கே நமக்கு வந்து ஒரு paralysis வந்துருமோ, ஸ்பைன் சர்ஜரி பண்ணால் ஏதாவது ஆகிடுமோ. They put all my doubts to rest and they were able to explain or non-invasive surgery la how much of blood loss, how much of idu will be there for me, even lesser than how much blood will be taken for a sample. And the அளவு of blood loss only I had for a 6-hour surgery. I have a plate.
Let me ask you a question. Do you feel today that you were late in taking the decision?
Yes, sir. Yes.
So see, that's the message.
Yes, sir. What I wanted to convey is, if you are in doubt, I belong to the 5% category which Dr. Balamurli said. 95% ku theva illa. 5% you have to see the doctor. Better to get it early treated so that you have a good life and you enjoy your lifestyle, so earlier the better. So thanks to them, today I'm able to strength train, I'm able to trek, I've gone on a trek, I've been able to do everything which I was unable to do, and the fear is completely gone out of my mind.
Thank you, ma'am.
You so
Thank you very much.
Thank you.
So that's a message to all of you. If you fall in that 5%, bite the bullet and take the decision. Don't suffer. Over to you, Dr. Umesh. So according to you, in your experience, vast experience, what are the most common reasons of elderly getting back pain, and exactly when should they go and meet a doctor or get a test done?
Elderly, usually the most common reasons for back pain is degenerative. Degenerative means as we age, wear and tear due to day-to-day activities get accumulated in the spine. It may be in the form of changes in the disc, it may be in the form of changes in the joints that are there in the spine. So like arthritis that can happen in your knee can also happen in your spine. So these can cause back pain. But these are the detectable causes. Now there are many times posture related causes can also cause pain in the elderly, just like they can do in the younger age population as well. Age related muscle loss, what we call as sarcopenia, that can also be a reason for significant back pain. Patients will have a normal MRI, normal scans, but they have significant back pain due to muscle loss, and that is one of the reasons that we have to identify.
So when do
Now,
you recommend to go to a doctor?
Yeah, so the two more, that is what. So usually what we follow in our practice is any pain, acute severe pain that doesn't show a subsiding trend in 3 to 4 days time. If it is a minor cause, in 3 to 4 days time, the pain usually shows a reducing trend. If it doesn't show that, you have to visit a doctor. Moderate to severe pain which is lasting for more than 10 to 15 days, you have to visit a doctor. Any type of pain, even if it is a mild to moderate degree pain, which lasts for more than 6 weeks, even if it is on and off, not continuous, on and off pain for 6 weeks, you have to visit a doctor. Pain that happens after a fall, after a trauma, after a sudden jerk, after your car or your bus goes on a hump and then you suddenly experience pain and that persists for a long time, you have to visit a doctor because that could be a osteoporotic fracture. Pain that is there even on lying down. So usually most of the pains, they disappear on when you lie down. Pain that is there even on lying down, severe pain is there, you have to visit a doctor. And also associated factors, like usually in elderly you can also have tumors, you can have other factors. So if there is a fever, if there is an associated weight loss, loss of appetite, if the patient is already taking steroids or some other drugs, in those cases you have to visit the doctor earlier than otherwise.
Thank you, Dr. Umesh. And over to you, Dr. Vishal. Is it true that women are more prone for back pain?
Yes,
Is it a fact?
That's true.
And what do you think are the lifestyle factors which causes back pain?
I think women have more chance of having back pain and neck pain because they have men like us in life. So if you take away men from their life, they'll have lesser back pain. No, so jokes apart. So yes, back pain, neck pain is far more common in women because of anatomical factors. Their muscle make is different, their body make is different. Plus they go through so many different kind of lifestyle changes in life. Pregnancy being one of them, menstrual cycle being another of them. Being subjected to hormonal changes on monthly basis has definite physiological effect on muscle strength also. The lifestyle is more sedentary, the stress factors are more. Plus they are subjected to far more stressful working environment, be it at home or workplace, not only sedentary but also stressful. So keeping all these factors in mind and also physiological and hormonal changes, they are more prone to develop back pain and neck pain. And that is why, precisely that is why, it is the responsibility of all, men and women, to ensure that women are more active, that care is taken for their bone strength, their muscle strength, their diet has more protein compared to men. Of course, everybody should, but women should in particular. And of course, after the time they are entering into perimenopausal area, there should be even more care should be taken to prevent fall at home and also to take care of their nutrition and exercise.
So do you feel that women should go to a doctor earlier?
Not true, but like Umesh mentioned, if there are warning signals or what I commonly call them red flags, if women face any of the red flags that Dr. Umesh mentioned, please don't hold yourself, meet a specialist. The commonest mistake that general population does is to treat back pain considering it to be innocuous at home. Nani dadi ka ilaj, please don't do that. Even if it is an innocuous pain, go and get this word from a specialist. You have the specialist next door. Now every hospital has dedicated spine specialist. Even if an innocuous back and neck pain is there, even if your x-ray turns out normal, please don't treat yourself at home. You might be missing something innocuous. A red warning signal which will need investigation could easily be missed by a general population's treatment at home. Please meet a
Thank
specialist.
you. Thank you, Dr. Vishal. It's a good message. So don't take it lightly. If you have all the red flags mentioned by the two specialists, please go and meet a doctor. So, Ma'am Lakshmi, now we have heard that the parents always bother about the size of the school bags in kids. So is it fact? Does school bag produce back pain?
It is a fact. Considering how heavy the bags are these days, நம்ம குழந்தைகள் வந்து அந்த பேக்கை தூக்கின்னு போகிறத பார்த்தாலே பரிதாபமாக இருக்கும். See, ideally speaking, the weight of the bag should just be 10 to 15% of the child's weight. So இப்போ ஒரு 15 kilo is the weight of the child na, the bag's weight should be say 1.5 to 2.2 kg. That's it. கூட்டி கழிச்சு பாருங்க கணக்கு சரியா இருக்கா? Hope so. So that should be the weight of the bag. So if the bag is too heavy, what happens? Your child's posture is bad. And to balance the bag, the kid starts leaning forward, slouching, and the center of gravity itself tips. Bad posture, strain on your neck, your shoulders, your back. So absolutely heavy bags are a no-no. So how can we help? கரெக்டாக குழந்தை டைம் டேபிள் படி ஸ்கூலுக்கு எடுத்துகிட்டு போட்டோம். ஸ்கூல்ஸில் த டீச்சர்ஸ் மஸ்ட் என்கரேஜ் த கிட்ஸ் டு லீவ் பிஹைண்ட் சம் புக்ஸ் அட் ஸ்கூல் அண்ட் ஜஸ்ட் நாட் கேரி த ஹெவி பேக் அட் ஆல் டைம்ஸ்.
Thank you, ma'am. That's very much, ma'am. Lakshmi, over to you, ma'am. Madhupriya, ma'am. Is it true that, back pain produces infertility? And can people with back pain undergo treatment for infertility?
Yes.
And have a normal delivery?
Okay. Back pain does not always lead to infertility. Back pain can be a symptom which shows that there are certain factors of infertility which needs to be treated. For example, வெள்ளப்படுறதுங்கிறது காமனாக லேடிஸில் இருக்கக்கூடிய ஒரு பிரச்சனை. But whenever that white discharge is associated with some change in color, whenever it becomes itchy, whenever there is a color change, it is very important that one has to see உள்ள ஏதாவது இன்ஃபெக்ஷன் இருக்கா. பெல்விக் இன்ஃப்ளமேட்டரி டிசீசஸ்னு சொல்லுவோம். அந்த மாதிரி ரீசன்ஸ் உள்ள இருந்தால் இன்ஃபர்டிலிட்டி வரத்துக்கு அது ஒரு காரணமாக இருக்கலாம். இட் கேன் அஃபெக்ட் த டியூப்ஸ், இட் கேன் அஃபெக்ட் த யூட்ரஸ், இட் கேன் அஃபெக்ட் தி ஓவரிஸ். ஆன் த ஹோல் ஒரு அனாட்டமி, யூட்ரஸ்னு ஒன்று இருக்கும், டியூப்ஸ்னு இருக்கும், ஓவரிஸ்னு இருக்கும், அதை சேஞ்ச் பண்ணக்கூடிய ஒரு ஆற்றல் இந்த அடேஷன்ஸ்க்கு உண்டு. ஸோ otherwise, back pain can be, it can tell us that there are fibroids inside, uterusல வரக்கூடிய கட்டிகள். அல்லது எண்டோமெட்ரியோமா, அதாவது சாக்லேட் சிஸ்ட்னு சொல்லுவோம், ஓவரிஸ் கருமுட்டை பைகளில் வரக்கூடிய கட்டிகள். இதெல்லாம் இருக்குன்னு நம்மளுக்கு தெரியாமல் இருக்கலாம், because most of them are asymptomatic. Being a fertility specialist myself, I see a number of people who have asymptomatic uterine fibroids and endometriomas. அந்த உள்ளே இருக்கக்கூடிய சாக்லேட் சிஸ்ட் கட்டிகளும் சரி, யூட்ரஸில் இருக்கிற ஃபைப்ராய்ட் கட்டிகளும் சரி, இன்ஃபர்டிலிட்டி காஸ் பண்ணலாம், பட் தேர் ஆல் asymptomatic. So back pain is something which tells that it is there.
Can they undergo treatment for infertility?
Yes, they can.
Can they undergo normal delivery?
They can.
Thank you very much, ma'am. And the last question to Dr. Umesh. We heard about this thing of osteoporosis, calcium, etc. Exactly what is osteoporosis and who gets it, and what should the general population do to prevent it? Dr. Umesh.
In simple words, osteoporosis means the bones become weak and brittle. Means that is the simple definition. There are a lot of medical definitions, but to understand, that is the simple definition. There are mainly two types that we need to understand. One is what happens in postmenopausal females, that is after 45, 47, 48 years. After that, what happens, there is a gradual decrease in the bone strength in these patients, in these people, then this is called a postmenopausal osteoporosis. The second type is involutional. Involutional means age related, which happens to everybody, both male and females, after the age of 70 years, and that is due to decreased bone formation itself. So these are the two main types that we need to recognize.
So how can we prevent it?
So the prevention is very important, and the main thing is dietary requirement of calcium and vitamin D. Now, it has been shown that Indian diets normally contain only around 300 to 500 milligrams of calcium in our routine diet, in our Indian diet. Whereas European and American diets contain around 900 to 1000 milligrams. So we are taking less calcium in our diet. So that is why it is more important for us, for Indians, after the age of 45, all females should take dietary supplementation of calcium. One glass of milk, normally 1 glass of 1% fat milk gives around 300 milligrams of calcium. So if you can have 1 glass of milk, usual dietary requirement, and take 1 tablet of calcium, which has around 500 milligrams, that is going to be a normal requirement, that is going to fulfill your normal requirement. Second is vitamin D, which is also important. Calcium alone is not enough. Vitamin D is also important. Again, vitamin D supplements have to be taken in all females above the age of 45 and in all both males and females above the age of 70. Exercise. It has been shown that exercise for 30 minutes for 3 times in a week is enough to improve the BMD by at least a few points to reduce the risk of developing osteoporotic fracture.